Now listen up. Have you ever noticed any abnormal vaginal discharge, like that white cottage cheese-like discharge? Do you have this burning sensation or pain in your vulva or vaginal region during sexual intercourse or while urinating? Do you always have this sweet itching feeling in your vagina? Do you notice these sores in your vagina or redness and swollenness in your vulva? Your vulva is that tissue that leads to the opening of the vagina. If you have these symptoms, you just might have vaginal candidiasis. But hey, it is not a death sentence. It can be worked on, it can be treated. So in this YouTube video, I'll be talking about vaginal candidiasis, the symptoms, preventive measures, and treatment. I'm very sure you will gain value from it. My name is Adin Joy, and I am a medical microbiologist. You are welcome. So vaginal candidiasis, first of all, is a fungal infection of the vagina. It could also affect the vulva, which, just like I explained earlier, is the tissue leading to the opening of the vagina. So it is caused by fungi from the genus Candida. Vaginal candidiasis is very common. It is the second most common infection of the vagina, next to bacterial vaginosis. So what about this vaginal candidiasis? How does it come about? First of all, let me explain the microbial environment of the vagina. Now, there are microbes we call normal body flora. These are microorganisms that are normal in the body. They are commensals, meaning that they don't affect the body in a negative way. They are commensals, they are just there. Most times they are beneficial to the body. Candida happens to be one of those normal body flora found in the vagina. Candida can also be found on the skin, in the mouth, in the gut, and in the throat. So they are normal body flora. In the vaginal region, we have the fungi population and we have the bacteria population. The bacteria population, an example of a bacterium that can be found there is lactobacillus, and an example of a yeast, like a fungi that can be found in the vaginal region, is the Candida. The lactobacillus and the Candida, they grow together in the vaginal region. They have to be at equilibrium to make sure that no infection comes about. But when there is a displacement of that equilibrium, when there is a shift in that equilibrium, maybe the bacteria are more than the yeast or the yeast are more than the bacteria, then an infection will come about. So in the case of vaginal candidiasis, there is a decrease in bacteria such as lactobacillus and an increase in Candida. So what might lead, there are different factors that might lead to a displacement of this equilibrium. Number one is taking of antibiotics when it's not needed. What this antibiotic does is it goes to that region, it clears off the beneficial bacteria that keeps the yeast in check, and because these bacteria that keeps them in check are no longer there, they now grow in a geometric way, leading to candidiasis. Yes, so those of you ladies that take antibiotics for everything, when you have a cough you take antibiotics, when you have a cold, antibiotics, you don't even know if it's a bacterial infection or if it's a viral infection, antibiotics straight. Those things lead to an increase in the Candida species found in the vagina and to vaginal candidiasis. So predisposing factors to vaginal candidiasis: one is taking of antibiotics. Number two, when you are pregnant, it increases the hormone estrogen, and this facilitates the growth of the species Candida. It encourages vaginal candidiasis. When you also take birth control pills or hormone contraceptives, it increases the level of estrogen and favors vaginal candidiasis. Number three predisposing factor is if you have a weakened immune system. This could be due to the fact that maybe you have diabetes, uncontrolled diabetes, or you have HIV, tuberculosis, or you're under chemotherapy, or you take steroids. These are medical treatment that weaken the immune system. And because this immune system is not strong enough to fight against these pathogens, are just the vaginal candidiasis. These are predisposing factors to vaginal candidiasis. So how can we prevent this disease? How can we prevent it? Number one is, please ladies, wear cotton underwear. Some of us, our underwears are so thick that if our vaginal region has mouth, it will be screaming every day. And some of you even wear underwears to bed. Please allow the region to breathe. Wear cotton underwears. Number two, please try to keep that area dry. Candida loves moisture. Even if you have to put on wet clothes or you have to be in wet clothes, try to limit the time by which you'll be in wet clothes and try to keep that region dry. Number three, avoid scented tampons and pads and bubble bath, all those that has perfume of one kind or the other. It's the chemicals in those feminine products tend to affect the equilibrium of the microbial population in the vagina, and it encourages the growth of Candida species, thereby leading to vaginal candidiasis. So please avoid all those scented feminine products. What are the symptoms of vaginal candidiasis? One, you experience vaginal itching, intense itching of the vagina or the vulvar region. Some of us, once you just get home, the next thing is to start scratching, and it is so sweet, you just keep. Number one symptom, vaginal itching. Number two, you have sores or redness or swelling in the vulvar region. Whenever you experience that, or there is an abnormal vaginal discharge, or you experience pain while urinating or during sexual intercourse, or you have rash, vaginal rash in that region, these are symptoms of vaginal candidiasis. And for some ladies, you don't experience any symptom at all, try to always visit your gynecologist. There are some persons that have vaginal candidiasis but don't show any symptoms. We say they are symptomatic. So you might just be in that category and you say, oh, just because I don't have the symptom, that means I don't have vaginal candidiasis. No. Try to go for a regular checkup. And just like I said earlier, it is not a death sentence. It is something that can be treated. There are some persons that also experience recurrent vulvovaginal candidiasis, meaning they experience this like 4 times in a year. Once it is treated, it comes back again. That means you are not adhering to the preventive measures that you're supposed to, or you don't take your treatment how you ought to. So please try to follow the instruction of your gynecologist. Don't self-medicate. That is the key. Don't self-medicate. Don't say, oh, because I have this symptom A, B, C, that means I have vaginal candidiasis and I can take fluconazole and nystatin and I'll be good. No. Even if you know the antifungal drugs to take, try to visit your gynecologist or a medical practitioner so that the necessary tests can be run on you and the necessary treatment can also be administered. Thank you for watching the video up to this extent. I'm sure you've gained value. Do stay healthy and remember, I'm rooting for you. Bye. Take care.